Hello, my name's Amanda Carson. I'm a veterinary surgeon and the small ruminant species expert lead at the Animal and Plant Health Agency. And I'm going to talk to you about a Thin Ewe project that the Animal and Plant Health Agency, APHA, carried out. This project was really conceived to investigate the incidence of iceberg diseases in thin adult sheep and also other causes of ill thrift in sheep. We invited private veterinary surgeons to ask their farmer clients if they would care to submit 3 recently euthanized adult sheep for the purpose of investigating the causes of ill thrift. We wanted recently euthanized animals so that we could collect blood samples from them before they were euthanized that could be used for testing. And this project ran between November 2020 and May 2021. The sheep was submitted from farms in England and Wales to APHA veterinary investigation centres and to our partner post-mortem examination providers, which are largely the universities in England and Wales, for examination. The APHA sites are shown in green with a 1 hour drive time associated in that shading, and the blue areas represent the partner post-mortem provider access. Where farmers live more than an hour from one of the investigation centres, they can take advantage of the free carcass collection service that APHA offer. That means a fallen stock collector can visit the farm, pick up the carcasses and take them free of charge to the investigating centre. We created a specific protocol for this investigation. We discussed with the private veterinary surgeon in the first instance about the farms and the farmers who were wanting to submit carcasses to evaluate if they met the criteria of being worthy of submission. So they were adult ewes that were in poor condition and that might normally go for culling. The farmer would submit those animals and we would submit them for investigation and specifically testing for the iceberg diseases. We recorded for each animal the breed, its condition and age and identification number. We carried out a full examination of the feet, the udder and the teeth and looked for external parasites, and then conducted a full post-mortem examination, including the examination of the brain, so the skulls were split along the midline axis. For the purpose of this project, we did not carry out worm egg counts, nor did we do worm washes on the intestines. It was largely to investigate the iceberg diseases. We also asked the private vets with their farmers to complete a questionnaire that gave some background history of the flock, of recent conditions that were of concern to them, management practices, and any recent treatments given. In all cases, we had a sampling protocol that included collecting specific samples to undertake specific tests. So, for example, pooled feces were collected from all the animals and subjected to a Johne's PCR test. For border disease investigations, we carried out testing on the serum and spleen. And for May divisna, we also carried out a May divisna agid test on the serum of these animals. Where there were sites of infection, we collected samples that were subjected for bacterial culture, especially where caseous lymphadenitis was suspected. And in addition, there were a range of fresh and fixed tissues that were collected from each animal and subjected for histopathology, specifically to diagnose OPA, Maidi-Visner and Johne's, and also for PCR examination. Where there was gross pathology, we also selected further samples for additional testing. Where there was lung pathology, we would take bacteriology from lung swabs and lung tissues for OPA PCR testing. Where there was lung pathology and Maidi-Visner was a possible differential diagnosis, we also collected samples from both the lung and the udder. Where gross pathology was seen within the intestines, we collected a range of tissues from the abomasum, the small intestine, ileum, and ileocecal lymph nodes for histological examination to determine if Johne's disease was present, but also would give an indication whether or not parasitic gastroenteritis was involved. And finally, at the examining vet's discretion, if any other gross pathology was seen, we asked them to collect samples for further testing. So, for example, if there was evidence of arthritis, swabs and joint fluids were collected for culture, tested for erysipelas and mycoplasma, and then any other histology as required, plus the examination of carcasses for external parasites, and we recorded all the dental disease findings. In total, 198 sheep from 76 holdings in England and Wales were received. The ages of these animals ranged from 2 to 7 years. They were mostly ewes, as this was a Thin Ewe project, but we did examine 4 rams. The presented signs were recorded as wasting for 75 of the farms, and 1 farm recorded the presenting sign as respiratory. The body condition at post-mortem ranged from emaciated to good, with the majority considered poor. The flock sizes ranged from 40 ewes in the flock to 5,000 ewes, and there was a mix of purebred and crossbred sheep. Predominantly, the submissions came from lowland flocks. 55 farms had identified themselves as lowland flocks, 19 farms had identified themselves as hill flocks, and in 2 cases it wasn't determined. The age was determined either by the age given of the animal by the farmer on the submission form. If that had not been provided, we estimated the age from the dentition. So the ages ranged from 2 years to 7 years old, with a fair number of animals in the under 4-year-old category. To show you some examples of the dentition that we found in some sheep, you can see here that sheep are missing teeth, that there's periodontal disease as well, and that's clearly going to affect the animal's ability to graze and to ruminate properly, and therefore that will have an impact on its body condition. In the abdominal cavity, we found various gross pathological findings, including peritonitis and evidence of damage to the liver suggestive of chronic liver fluke infections. In the respiratory tract, we found lesions that included neoplasias, abscesses, and lungworm. And in the intestinal tract, we found lesions, for example, the corrugation and thickening of the intestinal tract, which is often associated with Johne's disease, and also the classic discoloration, the yellowing of the mucosa that is sometimes but not always found with Johne's disease. The sheep came from farms across all parts of England and Wales, and the map on the left-hand side shows where the majority of sheep are in Great Britain. In England and Wales, the sheep populations are concentrated in the north, in Wales, and in the southwest. And so, for example, in the northwest, we received submissions from 14 farms, of which 9 described themselves as hill farms, and in Wales, 14 flocks submitted sheep, of which 3 identified themselves as hill flocks. We considered some diseases to be of a flock level significance, and clearly the iceberg diseases, Johne's, OPA, Maydivizna, border disease, and CLA can be considered of flock level significance. But Haemonchus and chronic liver fluke were also considered of flock level significance, depending on the accompanying history and clinical findings in the animals. And to reiterate that to diagnose these iceberg diseases, we performed a range of testing. So for Johne's disease, we undertook histopathology. There was evidence grossly. We did smears, serology, and PCR. For Maydivizna, this was diagnosed using histopathology and serology, but the histopathology would be definitive. For OPA, we carried out PCR, but we also confirmed this with histopathology. For CLA, this disease was diagnosed by culture of Corynebacterium pseudotuberculosis on swabs taken from abscesses. And for border disease, the diagnosis was made on a PCR from the spleen. However, we saw a lot of other diseases diagnosed, but we did not consider many of these to be a flock level issue in adult sheep. So, for example, dental diseases and dental issues might be seen in individual animals within a flock. Chronic pneumonia and abscesses may also only be seen in individual animals, as could Haemonchus and fluke, depending on the history of that flock. But overall, we diagnosed a lot of different diseases in the individual sheep, including parasitic pneumonia, dental disease, parasitic gastroenteritis, abscesses, pneumonia, haemonchosis, and also neoplasms. But interestingly, in the hill flocks, we did not see any diagnosis of Maydivizna, neoplasias, or mastitis. And overall, we found no BVD positive animals in the hill or the lowland flocks. At a flock level, Johne's was the most commonly diagnosed disease, followed by OPA. And in the hill flocks also, the largest number of flock diagnoses were attributed to Johne's disease, although we saw 2 flocks with OPA and 1 where we considered liver fluke to be a flock level problem. So in recap, Johne's was the most commonly identified at a flock level in both the hill sheep flocks and the lowland flocks, with 40% of the flocks, the hill flocks, having Johne's and 23% of the lowland flocks having Johne's in this survey. All sheep were border disease virus negative. There was a similar percentage of hill and lowland flocks that were positive for OPA, which was 9%, and chronic liver fluke at 5%. Haemonchosis and Maydivizna were only identified in lowland flocks, and the percentage cause not established were similar for both hill and lowland flocks, 10% and 9% respectively, and might reflect poor nutrition within those flocks. Overall, 2 flocks had 4 different diseases. 5 flocks had more than one iceberg disease, where 3 flocks had OPA and Ionis at the same time, 2 of those in lowland flocks and 1 in a hill flock, and 2 flocks had Ionis and Medivisna at the same time. Interestingly, 28% of sheep had dental disorders, where 14% of the lowland flocks had dental disorders with no other flock diseases identified. 24% of sheep also had histological evidence of parasitic gastroenteritis, and these were across a full range of ages, but it was notably more common in hill sheep, with 19% having evidence of parasitic gastritis with no other flock diseases seen. We identified lungworm in 14 cases, and consistently this occurred with other infections or lesions. So we considered that lungworm might in fact be secondary to these other underlying causes. Chronic bacterial infections were identified in 29% of the individual sheep, with diagnoses including abscesses, chronic pneumonia, chronic mastitis, chronic skin infections, just a range of chronic infections, and these might reflect the need to change management practices to reduce the incidence of these chronic infections. But what was also interesting was the finding that we were able to identify these flock level diseases where 2 or more sheep were submitted. So for example, from 8 flocks where only 1 sheep was submitted, we detected Ionis disease on 1 occasion, but that represented 13% of those animals, although we did identify a number of other issues in those individual sheep from those 8 flocks. But where 2 or more sheep were submitted, we had more chance of picking up one of the iceberg diseases or chronic flock infections. And this was interesting because we wanted to know whether or not undertaking a number of postmortems for a flock might help those flocks identify if they have problems with these iceberg diseases. And it might be a way that flocks could monitor the health of their flocks by submission of a number of carcasses to determine the presence of these diseases. The findings of this small survey have been shared in a veterinary record focus article, and we also gave a presentation to the Sheep Veterinary Society meeting at their autumn conference in 2021, and this was given by Susie Bell, a VIO at Shrewsbury. In addition, I presented the findings to the European Veterinary Surveillance Network